Both Emma and I wanted to put in a little blurb for this episode, as it's one that is particularly good to watch on YouTube. Maude does an excellent job of explaining some of the equine dentistry pieces as well as anatomy, and she does use quite a few hand gestures as she's explaining them. And so for those listeners out there who might just be listening to the audio file, this is one that we would both encourage you also check out YouTube for.
Yes, and I will also say that after we finished recording, the conversation kind of continued on and was quite good. So we decided to then start recording again, and Maude goes into some more depth about a couple of topics that she had covered in the podcast. So we will also be adding in at the end a little extra bit of golden information for you guys all to watch or listen to.
Recorded in the beautiful mountains of British Columbia. Welcome to
Friends on Horses.
Today we get to talk dentistry with Doctor of Veterinary Medicine, Maude Gagnon. Maude graduated in 2008 and now is a practicing small and large animal veterinarian out of Nelson, British Columbia. Maude has had additional training in dentistry and sees continuing education in all aspects of her work as very important. When she's not working, Maude is exploring the Kootenays on foot or by horseback. We are excited to learn more today about equine dental care from the perspective of a veterinarian. Thank you so much for joining us today.
Hi, thank you for having me. It's a pleasure.
Both Emma and I have been just so excited for this episode and to learn more about equine dentistry. I'm wondering if you can start out just with explaining both to us and to our listeners just how horses' mouths are put together.
Yeah, so horses, they're herbivores, right? So basically they eat forage, they need to grind it, process it, so they can get all their nutrients. So what's particular about horses and like cows and deers, their teeth are called ipsodont teeth. So basically when they're born, they have the teeth, which are about like 15 centimeters in their head, and then they will erupt, so come out throughout their life, and they'll grow between 3 millimeter and 2 centimeter per year. Wow. So it can vary a lot from one horse to the other. So that's why like horses' teeth change all the time, basically. And what's outside the gum, what you can see, it's called the crown, and then they have a reserve crown. So the enamel, what's on our teeth, keeps going in horses below the gum compared to us, which doesn't. And then at the end, you've got the root of the tooth. And then in horses also, since the teeth grow all the time, they can actually they can produce like dentin and cementum, and like our teeth are the same all our life, but horses, they have a way of fixing teeth because they grow like that. So yeah, it's quite impressive what they can do with their teeth, actually. And then like rabbits are another example. Their teeth grow, but they actually don't have any roots. They just produce them. The horses, they have a tooth, 15 centimeters, and when it's gone, it's gone. There's no more. A rabbit will just keep making teeth. Also pretty impressive. Then the horse's mouth, well, it's quite, you notice their head is really long, the opening is very small, and then so it can make it hard for us to look in there and work. Also, another particularity is the top jaw is wider than the maxillary is wider than the jaw, so their teeth don't align. So the top teeth are like this, and the bottom teeth are like this inside. So that will create those famous points in the cheeks or points towards the tongue. And they're on an angle, the molars, compared to us, which are flat. And then their teeth, they have their incisors, there's a gap, and then molars, premolars, and molars, and their molars go all the way under their eye. So it's a really long surface that they use for grinding the food. You have any questions on that?
Oh my gosh, there was so much. I just learned so much. We can end the podcast now, I think. I have a question actually, because one thing you said earlier, you're talking about how the horse's teeth, like the kind of have this really cool regeneration process. Is that what you mentioned? Like they have a system that because they only have that one tooth, they have a system to kind of take care of the tooth. Was that right?
Yeah, basically, like so our tooth, we have the enamel that protects, and then inside you've got the like horses. Well, there's cementum and dentin, and then the pulp. So in a horse, everything is kind of twirly. So the enamel is not just on the outside; it goes on the inside, and then the pulp is blood flow and nerve, and it feeds the tooth, and it can actually, it can regenerate cementum and dentin, so that if when it wears, the tooth realizes it and can strengthen the cementum and dentin. And if they have injuries, they can kind of pack their teeth sometimes. But it's to a certain extent. Like if it's a really bad injury, they won't be able to fix their tooth. But if it's small injuries, sometimes they can actually plug holes with their. Yeah.
That's fascinating. I had no idea. One thing that I was thinking of is I've often spent time with younger horses, and of course around kind of the 1.5 year mark, they're losing their caps on their teeth. And so you can kind of find them in the water bucket once in a while. And I'm wondering, what is the purpose of the caps that they're born with, and then also losing those caps? Because it's not quite like our baby teeth where we regenerate the whole tooth and it kind of pushes the old one out. So I'm wondering if you can speak to that.
Yeah, well, actually, no, it is like our teeth. The cap is the baby tooth.
Okay.
Yeah, and then when the adult tooth comes in, it pushes it out.
Okay.
And at the same time, it pretty much destroys the root of the baby tooth. So usually you don't see the root really. It's because it's gone, and then just the cap, which is the outside, the enamel part, falls off.
That's fascinating.
Yeah, that's so super interesting. Oh my goodness, I'm like, I have about 6 questions bouncing around in my brain right now, and I'm trying to think about which one should I start with. Well, maybe what we'll do is we'll talk a bit about, because I almost feel like we could bounce to age right now.
Yeah, sure. I can keep going talking about like the number of teeth and age at the same time.
That'd be great. Awesome. Yeah.
So yeah, a horse has between 36 and 44 teeth once they're adults. It varies because of the canines. So males can have canines usually. Females, the odd female with mare will have canine, but a lot they don't. And then the wolf teeth also, they could have 4. Usually they just have 2 at the top. Sometimes they have 2 at the bottom. So make it up to 44. And then 12 incisors at the front, 6 at the top, 6 at the bottom. The first 4 incisors, they grow before the first week of the fall. So after he's born, right away, the first incisors grow. And then I've got my little chart because I can't remember all that either. Around 4-6 weeks, second incisors grow. 6-9 months, third incisors grow. And these teeth, when they're 2.5, they're going to lose the front. So the first incisor at 2.5, 3.5, they'll lose the second incisor. 4.5, they'll lose the third incisor. So when they're young, under 5 years old, it's really easy to tell how old they are, and we can be really accurate with the incisors. Then they've got wolf teeth, which are premolar, but they're not doing much, really. They're just leftovers. Zebra have a big one. They kept theirs, but our horses just got rid of it. And then they've got 3 premolars and 3 molars on each arcade, so times 4. And the premolars and the molars are actually the same. They're same type of teeth, and they grind, and they're not all the same size, but they're quite big. And yeah, so that's about the number of teeth. Incisors are meant to grab and cut. Molars are meant to grind food, make it in small particles so that the stomach can digest properly, and then you can absorb all your nutrients. Yeah.
Awesome. Awesome. And when does it become harder to tell the horse's age?
So yeah, by age 5, all the teeth are out now. The last one being the canines, around 4.5, 5 will come out. After 5, then yes, you can tell by a few years usually, but the older they get, the more the error becomes big, because like we know now, the teeth grow between 3 millimeter and 2 centimeter a year. Could be faster a year, slower the next year. So after 5 years old, well, there's different things we can look at. So if you look at we look at the incisors, because that's pretty much all we can see. And if you look, so you can look at the shape of the incisor. So when you open their mouth and you look at the lower incisor, because it's just easier for us to see, when they're under 11 years old, they're more a round shape. And then after that, they become a triangular shape slowly, and then a rectangular shape. So for that, you need to open them out and look at their surface. After that, you look at that surface again by opening their mouth, which can be hard just to do and keep the horse open, mouth open like that. And the surface will change because at first it's covered with enamel, and then as they wear, then you will get to the other layers of the teeth. So then there's things like cup. You can look at the cup. You look at stars, spots start appearing. For example, if you don't notice a young adult incisor, when you look at it, there's actually a hole in it. That's called the cup, and this cup the horse will grind the tooth, and at about 8 years old, that cup will disappear. So you can use that to say if the horse is less than 8 or older than 8. Mm-hmm. And then when you get to the end of the cup, then you see a little spot that appears, the enamel spot. And then a dental star will appear after that. And that's where the pulp used to be. Okay. And that's where the horse regenerating his tooth is important, because the pulp, if you just cut through it, it's going to bleed, right? But if you grind to it slowly, then the horse will produce some cementum and dentin so that the pulp doesn't get exposed. So then you can start seeing the dental star, it's called. And yeah. So that's another way of telling age. Then you can look at the third incisors of horses on the side. There's something that's called the I'm not sure how to say it. I think it's Galvin's. Sorry, my French is Galvin's groove. So that groove will start appearing at the gum line when the tooth grows. And it starts to appear around 10 years old, makes it to the middle, halfway of the tooth at 15-year-old, 20-year-old, you can see a line all the way on the side of the tooth. 25, it's half gone, and 30, there's no more groove. So that's another trick. But when I age horses, I have to look at my chart also, because I can't remember all those things. Yeah.
It's really fascinating, and it speaks to the different needs of horses when it comes to dentistry throughout their lives too.
Yeah, for sure. It's a constant thing in motion, their mouth. It's quite impressive how it can be really it's pliable slowly, and they're really resilient. It's like, you can think when people have braces and it takes a while, but you can move your teeth and it changes your bone shape in your face and around the teeth. So horses do that all the time because their teeth grow, and they need to produce bone around the teeth, less bone. So yeah.
That's amazing. And that's actually a really good kind of flow point into another question that we had, which was brought up by some of our Facebook listeners too, was about the teeth body, the connection between teeth and body balance and body health.
Yeah, well, dentistry in animals and humans, really it's part of your general health, right? There's debate as in humans if it should be considered medical, actually, which I think it should, because if you have an unhealthy mouth, well, it can lead to so many things, like you get bacteria in your body, so infection in your kidneys, infection in your joints. It's been known the bacteria go to your heart, especially if you have heart disease. So having a good mouth makes you healthy, basically. And teeth, the main purpose is digestion, right? So if you can't start it right, well, you're not gonna get nutrients to have a good body weight, have good muscle. So, and then also if you have pain in your mouth, well, it's gonna make you grumpy, behavior problem. Pain causes stress. Stress, basically, it's stress hormones and like cortisol, and we know that's bad when it's high in your body. Stress hormone can causes inflammation, basically, in everything in your body. So like joint inflammation, sugar level goes up when your cortisol goes up. So yeah, having good teeth is really important for your nutrition and general health, and not feeling pain is quite important also.
That's so cool. It's even maybe our insulin resistant horses, we want to pay more attention to make sure their teeth are really good, if that's going to affect their processing of sugars, hey?
Yeah, definitely. And like example, like a Cushing horse, their cortisol level is high, makes them prone to more infection. So if they have a bad tooth, they might get the abscess compared to a horse that doesn't have high cortisol in its blood. That's the dramatic example, but yeah.
I know there was a lot of questions too raised just around hay nets and how that impacts horses' teeth. I'm wondering if you can speak to that a little bit.
Yeah, so hay nets, I tried to look for studies about how it affects like the wear on the teeth, and I could not find any. So I started to wonder why no one looked at that, because yeah, you think it's gonna change the incisors if they chew. Then, so I don't know. I'm thinking maybe, how long have hay nets been around? Like 10 years? Like, What do you think?
Yeah, I feel like it's at least been more popular and common over the last 7 to 10 years would be my guess.
Yeah.
You know, because now we see them everywhere. At least here in the Kootenays, here in BC,
Yeah.
and probably Canada. It's like, you know, very, very common. Almost everyone has their horse on hay nets now.
Yeah. So I'm thinking, you know, horses live a long time. 10 years, I don't know if it's enough to see what it does to their front teeth, actually. So maybe we'll know more about that later. But hay nets, mostly, we know that they help slow down their eating, right? Because in the wild, a horse, they will eat for 15 hours a day, graze for 15 hours, which means they spend 15 hours with their head down, and they spend 15 hours chewing. And when we put them in a stall or in a pen and we feed them flakes on the ground, so it's gonna take them, I don't know, between 1 and 3 hours to eat the hay. My horse eats it like crazy fast. So she's in a hay net. So we know that hay nets, there's studies that's been done on that. When the holes are really big, like a few inches, it doesn't change much about how fast they eat. Once the holes start getting below 1 inch and 3/4, then it's been shown that the horse takes longer to eat. And taking longer to eat, well, makes them closer to what they would do in the wild. And we know that eating slowly helps. It helps the acid in the stomach stay down, because ulcers happen when your acid goes up, and horses need to eat to keep the acid down because they produce it all the time. Like other animals will just produce like enzymes when they eat, kind of like us. We produce more, and then, you know, you're hungry, you know, it starts gurgling, your body's telling you, oh, it's time. Eat something to buffer that acid. But horses, it's nonstop. So if it's important for them to eat slowly and all day to protect their stomach, so that helps. And then having their head down all this time, it actually has an impact on clearing their lungs and their trachea. So just by gravity, basically the secretions in their lungs, it goes down the trachea and out the nose. So hay nets, it's actually been shown that horses that eat out of hay nets, they have more problems they can have more problems with their lungs. Because when it's on the ground, the hay, they just spread it around and it airs more. So all the fine particle that you don't want to breathe in, it maybe goes on the ground or it goes in the air. So the horse gets inhales way less of it. So for horses with breathing respiratory problem, it might actually make it worse for them to eat out of hay nets. So there's that. And then putting your hay nets on the ground is also better, because if you put your hay net high, then they'll eat for all this time with their head up. It's not going to clear their lung either. So that can be another problem. And also, the bottom jaw of the horse is it doesn't just move from right to left, it moves from front to back. So, and when they put their head down, the bottom jaw goes forward. Not a lot, but maybe 0.5 centimeter, 1 centimeter. And that's when they grind their food with their head down. So if you put their head up, their bottom jaw goes back, and then the teeth back there don't line up anymore the same way that they would if their head was down. So hay nets are good to slow the horses down, but they can have other repercussion on breathing and respiratory and dentition a little bit. And the wear on the incisors, that I'm not sure about. We'll know in the future, I think.
I love how you put that, even thinking about where your horse is eating and how that's wearing on their teeth, how that affects how, like, whether your horse's head is up or down, can affect how the jaw is lined up, which may affect in the future how what type of work that your veterinary dentist has to do. Is that kind of what you mean there too?
Yeah. Basically, if the upper arcade, we call it arcades back there. So there's the maxilla is the top jaw, so the maxilla arcade, and the mandible is the lower jaw, so the lower arcades. If they don't line up properly, well, at the front or at the back, you're gonna have like a little, instead of being like this, if they're like this, then teeth need to face each other to wear. So if they don't face each other nicely, then they can get small hooks at the front first tooth or at the bottom last tooth are the most common. So yeah, it can affect those things. And then there's other things that can happen, like transverse ridges, which are abnormality in the arcade plane. Basically, you can get little bumps instead of a nice straight grinding surface. So yes, it does affect that.
So interesting. That's so interesting. So a little takeaway for our listeners might be, if you're going to use hay nets, make sure that we've got, a good air circulation so that, it doesn't have those negative effects on breathing if possible. And then think about location, because location of your hay net can definitely affect the type of teeth wear that happens.
Yes, yeah, I think so. And also I would say, depending on the age of your horse, an old horse that has trouble eating might not benefit from a hay net. You don't want to make it harder for them. So just take that into consideration as well.
Oh, that's great. Since we're talking about teeth wear, let's talk about floating. What the heck is floating, and why does it need to be done?
Yeah, so floating. Well, basically, floating is, or we can talk about like a mouth exam at the same time. It's important to have your horse's mouth examined. And then, most of the time they'll need something done in there, so need some floating. Once in a while they don't, and then so it's pretty rare. But once in a while I look at a horse's mouth and I see nothing. So then we just close it and say good job. So floating is basically where we use instruments like. Now we use like a power tool, power float. There's also hand floats, and we go and take away some small abnormalities, basically, in the horse's mouth that will appear because of some things we talked about, like their teeth are constantly growing. They don't oppose normal, like straight. So over time it's going to create it can create small defects in their mouth. And then what we do with the float is we just go and if we see little like spurs that will poke in the horse's cheek, we will take that down. And basically the goal of floating is to maintain a grinding surface that's efficient and prevent also problems in the future, and take pain away if the teeth are growing in a way that's causing the horse some pain. And yeah, we need to float also, because even if we use hay nets, the horse won't eat 15 hours a day. So they're not grinding their teeth as much probably as a wild horse. So that affects how they grow as well, right? And the type of food we give them also affects how the teeth grow. So yeah, that's kind of why looking at the horse's mouth is important every year, ideally, and then floating if necessary, basically.
Does it change with a horse's age how often they need to be floated?
Well, if there's more problems that can happen depending on the horse's age, for sure. Yeah. So, for example, like when they're young, under 5 years old, a lot of things happen in there. So around let's see here. At the back of their teeth, so their premolars grow really fast. By 2 weeks, they have all their premolars, which is 12 teeth. At 2.5, they'll lose the premolar. So they'll lose caps, not only at the front, but they're gonna lose baby teeth or caps at the back also. And those can get stuck, actually. And if they get stuck, well, then the adult too can have trouble coming out, or it's gonna come out crooked, and or it can start rubbing in its cheek and cause some problems. So when they're young, the teeth grow fast, things change a lot in there, and often I will find that the young horses, they have quite sharp points in their cheeks that need to be filed under 5 years old. So people often think they don't need their young horses' teeth looked at because they most likely have good teeth, and it's true, they most likely have good teeth, but they can still get problems from erupting teeth and caps not falling and ulcers in their cheeks. So that's what we look at when we do young horses' teeth. Between 5 and 15 years old, if everything went well when under 5 and they all have nice and straight teeth, they might not need a lot of floating, or they might just need small points smoothed out in their cheeks or on their tongue side. And then, but at the same time, if they have a crooked tooth, they might need work all their life that you're gonna know when you do an exam. And after 15 years old, then the horses are more prone to start having problems. I think they say they did donkeys between 16 and 20, 96% have dental disease. That's between 16 and 20. So, and the horses, yeah, after 15, also more chance of having like bigger abnormalities. So, and then between 18 and 21 years old, that first premolar, that first adult premolar that grows when they're young, at 2.5, was the first one to reach the end of its life between 18 and 21. So that one will stop growing because there's no more. So then you will start getting wave mouth, steps, some abnormalities that way, and this will change the grinding surface. It's going to make it less efficient. So our work when they get older is to keep the grinding surface as efficient as possible and eliminate painful conditions, basically.
Interesting. I'm going to jump in because you said donkeys, and anytime someone says donkeys, I get excited because I have a couple at home that I love. I'm guessing that donkeys often have issues more often. I can't remember what age range you said or after what age, but Is this because they tend to be obese, and like you talked about earlier on when we were chatting, you know, an insulin-resistant animal is more likely to have the issues they're having with their teeth to be larger issues because of that? Like, what do you know why, or is it because we tend to take less good care of our donkey's teeth?
Yeah, actually, I don't know why. Maybe it's a combination. Maybe it's just conformation, how they have a smaller head. But no, actually, I don't know. I did notice that donkeys have a lot of tartar for some reason. So I'm not sure why that is either. Maybe it is because people don't float them as often in our area, or maybe it is because they're obese and making it more prone to infections. But yeah, no, sorry, I can't answer that question.
That's okay. That's okay. I know that there's less research and such done on donkeys, but I find it yeah, being a donkey lover, I just find it very interesting. We can move on from donkeys now, but thanks for taking that moment for me.
Well, another donkey fact.
Yes, please.
And actually, I learned that in the last 2 years, I think. I didn't know before. Often when you look at their front teeth, they smile or they have a V shape.
Yeah.
And actually, I mixed up my percentage earlier. It's 96% of donkeys will have a V in their incisors, which is not really considered normal in horses, but donkeys do, and that's normal donkeys. And it seems like it doesn't interfere with anything, so it's considered normal in donkeys.
Oh.
Yeah. So my other percentage was off, but yeah, 96% of donkeys have this.
Wow. That's so cool. So yeah, once again, it's like we can always compare our donkeys to our horses and treat them the same, but you know, there's another little fact that's like, no, they're not. They're not the same animal.
Not quite.
No.
Just before we move on to the next question, I just wanted to loop back to the age to start looking at teeth, because I think it's a pretty common misconception to only start to float once horses are older. But just from your description of how much is happening and changing for horses, it sounds like really starting with dental exams really from an early age is quite important.
Mm-hmm. Yeah, I think you know, 2.5 usually, and I'd say most of the time people call us at 2.5 to have the wolf teeth looked at if they have any, and if they need to be removed, because that's a common thing that people will do, so the bit doesn't touch the wolf teeth, which is the first premolar that is now barely a premolar, and very small roots. They're about like, sometimes they're just 1 centimeter, sometimes they're 2 centimeters. So at 2.5, often we'll look at the horse's mouth and take that wolf teeth out and look at everything. So that's a good age to start. And then just a yearly exam is a good minimum under 5 years old. Yeah. And after that, the way I like to do it with my patient is if it's the first time I see a horse, and let's say he's 7 years old, so I look in there, there's points, there's little things, and then I like to look at them a year later. If there's like no change, you know, then I go from there. But it's nice to see in a year what's gonna happen to this particular horse. And some horses, there's not gonna be much change in 2 years, but some horses, every year they're gonna get really sharp. So those horses, then you want to do them every year, even if they're a 9, because then you know they're gonna get sharp.
There's obviously, so there's obviously things that you look for when you're looking at horse teeth and things that owners can't look at or look for. But I would love to know a little bit more for people what signs they should be looking for when they're kind of keeping an eye on their horse's teeth, like when they need to be done. Is there any maintenance that they can do to make sure their horse's teeth last longer? Yeah, what can owners look at? Like, how can owners do a better job of keeping on top of managing and examining their own horses?
Yeah, so it's good for owners to know their horse and know what normal is for them. So signs, I'll tell you some. There's so many different signs that can show that the horse has something that's bothering him, and it can be very minor signs or it can be major. So, for example, some horses will just hold their head different when they're riding them, because the bit is bothering them, or being placed on the bit and getting that pole down. It can hurt their jaw, put pressure on some teeth. So holding their head different. Then it can be behavior change. That doesn't mean it's a dental problem, but it means something's bothering them. But it can be so many things. If only they could talk, right? So behavior change can happen. Chewing the bit more when you didn't used to. Horse becomes head shy, all of a sudden doesn't want you to touch him there anymore. Horses that start to salivate, if you see drool coming at the corner of their mouth, that can be a sign. They will eat their food with their head sideways instead of straight, can be something. Then you can start hearing noise from their mouth. So, you've all heard the normal grinding sound, but then if it starts to clunk or squeak, slurping noise, that's probably not normal. If the horse starts spitting hay, grain, quidding, which is they chew hay forever, but they can't really grind it, so it comes out in big balls of hay. That's called quidding. Sign something's wrong. Sometimes it's just one tooth that's moving back there that's bothering them, so they can't get the hay past the tooth. Then if the horse now takes longer to eat, he used to eat faster, and now it takes him longer. The horse becomes picky, so used to eat anything, and all of a sudden he just wants the small alfalfa leaves because he can't chew the stems anymore. Smelly, if the horse's mouth is smelly. Eating less because it's painful. Colicking, another thing. Then it's good for horse owners to feel the horse's face. If they start in the jaw, they can feel along the jawbone for any swelling. Those you'll notice when they're young. I'm sure people notice they get bumps on their jaw. That's kind of normal. It's because the adult tooth trying to get out, and it's getting inflamed. So those are normal when under 5 years old. But a bump like that on a 10-year-old is not normal. Or if one persists in a young horse, can be not normal either. Discharge from the nose could be tooth related. If a horse starts packing food in their cheek, they're probably not doing it because it's cute. They're not chipmunks. Weight loss, and then horse owners can also look at the stool of the horse. It looks like hay, right? With small fibers of hay in it. If they become longer, the fibers, that may mean the grinding surface is not working properly. So under a centimeter is about normal. over that is too long, it means something's wrong. If they start noticing grain in the stool, in the manure, that's not normal. But often, like, there can be dental abnormalities, and so dental abnormalities are quite common, even mild one, like those sharp points causing an ulcer. But most of the time, you won't see anything in your horse. So dental disease or abnormality are common, but signs are not common. Mm. So I think that's why it's important to have a good look back there once in a while, because your horse won't show you. They're survivors, you know. Mm-hmm. Yeah, so do you have questions on that? Otherwise, I can, I don't know if I had a few more things about what owners can look for. Yeah, then they can, you know, to maintain a good, healthy mouth, owners can feeding hay, you know, pasture. If everyone could have access to pasture, that would be great. But that's just a dream. But yeah, basically, the more the horse chews, the better it is for his teeth. So hay can be expensive. Sometimes owners will give grain instead, but really grain should be only reserved for horses that you can't get weight on with hay only. So horses like, you know, race horses that spend so much energy racing, they would have to eat, I don't know how much hay, like a lot of hay to keep up with the energy demand. So those horses, they'll need some grain to supplement the energy. Otherwise, they can't eat. I don't know how much they would need to eat, but it's a lot. And then our old horses that eat super slow, well, they maybe can't make it through 25 pounds of hay a day. They can only chew for so many hours, and they'll make it to 10 pounds of hay a day. So those guys, you'll need to supplement in grain or processed feed, more pellets. So if your horse wants more hay, give it more hay for a healthy body weight, keeping their body weight healthy. But if you don't want to cut back on hay, you know, if your horse is getting overweight, you cut back on grain. Mm-hmm. Yeah, so that's something they can do. Do you have questions on this so far before I keep talking?
No, I think that's great. It's nice to kind of have a few tidbits to kind of look for when we're out in the paddock with our horses, just for those signs that there might be something going on in terms of teeth health, dental health. So that's really helpful. I'm curious, because they're constantly kind of regenerating those pieces of the tooth that you spoke about before, are there any supplements that you would recommend in terms of minerals that people should be incorporating into their horse's diet to support the overall teeth health?
Actually, I don't know if there's specific supplements for that. That would be, you know, more question for a nutritionist. I would think, you know, if the horse's diet is complete, you should have everything he needs to. Mm-hmm. So yeah, it's important to have the, you know, right amount of protein, energy, minerals, vitamins. But once if he's got everything, he should be okay. But yeah, nutritionists could help you more.
It's that it's that kind of reminder again. We can't cut corners with our horses. You know, it's like making sure that they have good quality roughage, and if they're a senior horse or whatever, you know, if they're having a hard time putting on weight, then, you know, maybe they are a horse who could use a little bit of grain. And probably if they're getting good quality food, then they're getting those minerals that would support the same things that support their joints and their bones, I would guess, are probably the same things that would also be supporting their teeth. So just really thinking about, we can't cut corners with our horses, and good quality basic nutrition, and beyond that, if they need more, then there are equine vet nutritionists out there that people could reach out to. Hey.
Yeah. Well, yeah, and I know like some of them work for some companies that make supplements, or those companies will hire the nutritionist to help make recipes for them. So every food company should consult with a nutritionist. So actually, that's something that is kind of important to do whenever you choose a food, even if it's for your dog. I would make sure that the company has a nutritionist working for them. Yeah, you can actually call them and ask.
Oh, that's a great tip. What a cool idea.
Yeah.
I know we got a lot of questions about incisors, and you've already kind of touched on them a little bit earlier, but I wonder, incisors seem to be a very hot topic when it comes to dentistry. I'm wondering if you could just expand on the importance of kind of incisor health for when you're considering equine health.
So incisors, yeah. Do you want me to talk about like maybe the float appointment first? I guess
amazing. Yeah.
And then because then I look at the incisor and then I can talk about incisors.
Perfect.
Okay. Yeah, I guess we started talking about float and then I went to something else. I guess
it often happens. We'll kind of different direction, a different tangent.
I probably wanted you to start talking about donkeys and diverted you.
Okay. I don't want this anymore. Sorry. I guess you can edit this part. Okay. So to go back to floating. So we said when we should start examining the horse's teeth, which is pretty much when they're young. And so when we go and when we're called in for a float, well, first what we're gonna do is just examine the horse in general, ask some health questions, if the horse is having any difficulty with his chewing, with his manure, diarrhea, if he's coughing, losing weight. So sometimes people will call the vet because there's a problem, and sometimes it's just going to be for maintenance. So the questions we ask might change a little bit depending on the history. So when we go in to do a float, yeah, we'll do a basic exam, ask some questions, and then I will, when you look at the head, you look at if the head is symmetrical, if there's lumps anywhere, look at the nose, discharge, look at the lips, feel the jaw, feel the lymph nodes, see if there's swelling. Then after questions and exam, then I will weigh the horse with the tape. Some vets will just estimate the horse's weight because it's an estimation anyway, the tape. Take the weight, and that's important because to have a good look inside at the back of their mouth, we need to give the horse some sedation, right? So sedation, you can give oral sedation, in the muscle sedation, IV sedation. So most horses that are, well used to people and well trained will tolerate an injection in the vein. So for most of them, we will just give them an injection in the vein. And owners can actually prepare for that by doing some training, like your clicker training. that can help us a lot if the horse is used to having the veins touched, and trust the owner with some clicker. So yeah, and then if the horse is nervous, or the owner knows that he really doesn't like injections, we can give them an oral sedation to give before we get there, so that the horse is calmer when we're there, and then we will give the IV sedation. So usually we examine the horse, and then we set up in an area that's safe for the horse to be. So ideally, you want 3-wall with a light that you can turn off. But in reality, sometimes we're just outside in a field and it's fine.
What? Really?
Yeah. So as long as it's a safe area where the horse, because he might stumble with sedation, so you don't want him to stumble on anything to hurt himself. So safe area. So the veterinarian will set up his things, which can be a headstand to hold the head up, or a halter over a wood beam at the ceiling to hold the head up. When there's nothing, when I was younger, I was the post holding my horse's head. So things have evolved now. We try not to make the owner work as much. So then when we're all set up, we'll need water as well. So the equipment consists of on floats. So usually power float. There's hand floats that are, like I said, not really used a ton anymore, because mostly it's quite difficult to work with them. It's exhausting for the veterinarian, and it causes more trauma in the mouth, because there's that big thing you need to move back and forth, and you hit things with it. So I was so happy when there was no more hand floats needed. And power float, it's a drill basically. It's easier to get in small places, and there's less trauma if you use it properly. It's way easier for the vet. Negative of power floats is you can sometimes cause injury from heat, because it generates a lot of heat, and you can remove too much, so you need to be careful and know what you're doing. So you set up your float, you set up the stand, you get water, and then we need something to clean the horse's mouth, so a big syringe. We need then a speculum, which is an instrument that we use to open the horse's mouth, so we can have a good look back there. We'll need good light to look at the back of the mouth. Need gloves. But we're all set up. We give the horse sedation. Then the owner, usually, I give little directions how they can help. They can stabilize the horse's head, but really we can't. The horse is so heavy, if he decides something, he's gonna do it. So we can only stabilize a little bit, or stabilize so much. Sedation, it's gonna make the horse a little bit wobbly. So basically we try to use, it's a balance of using enough so the horse is not stressed and lets us do the work. And if he does have dental pain, sedation is also a painkiller, so it's gonna relieve some of the pain. If he's got an ulcer and I'm gonna have to push on the cheek to get to the tooth, well, he might feel it in that ulcer, so the sedation is really to relieve stress and let the horse, let us work on him, and some pain control. And we try to give enough so we can do all of that, not too much that the horse will stumble around and fall. But horses can sleep standing, so usually they stay standing. I've never had one fall actually. So and some will be more sensitive than others. So if we do work again on the horse, we can adjust our dosing depending on what happened the previous time. Then once the horse is sedated, I will clean the mouth. Then I will look at the incisors first, and yeah, inside the lips, at the tongue. Some horses don't let us look at their incisors when they're not sedated, so that's something owners can work on, touching their mouth. Some are really not happy with us touching their lips to start with. So yeah, I will look at the incisors. I will look at how the jaw is moving. I will make it grind by moving the jaw, see if the grinding sound okay. And then we will put the spiculum in, open the mouth, put the light in, examine the tongue, the cheeks, look at all the premolars, the molars. We'll smell things. Put our hands in there and go feel. Sometimes you can see things, but sometimes you can't really see because it's so far in there that so there's some vets that are a bit more scared to put their hand in there because you could, if the speculum gives, then you might get a sore arm. But most vets will put their hand and go feel at the back. And some veterinarians that do lots of dentistry, they even have a scope, so a camera, and they'll put the camera in the horse's mouth with a light and go look at the back too, because it's so far that there's things you can't really see. So yeah, specialist dentists will use a scope, and then we determine if there's abnormalities, and we'll float what's needed. And after that, after we're done fixing things back there, or just correcting like little things, basically we want to make, like I said, the goal is to remove as little as possible, because we want them to have as much teeth as they need for as long as they need. So we want to keep a grinding surface that works good, and we want to prevent pain. And we want to take away things that we think are becoming a problem or will become a problem. If a wave is just starting, that's when you can actually address it. If the wave has been there for 5 years, could be a really bad wave, and you're not gonna be able to fix it. But if you get things at the beginning, then you can prevent a lot from happening, right? Then once we're done doing that, take the spiculum out. Then we look at the incisors again, because working on the molars can actually change the way the incisors move. And then we will decide if the horse needs incisor work or not, basically. I'm having trouble. On his diet. Okay.
That's so fine. We're having wonderful conversations that are lasting so long that your phone just gave out on you. I've got a couple of questions, and Mira, you probably do too. There was a lot of wonderful information there. In our community, at least, there's a lot of worry about power tools and questions about power tools versus hand tools, and it sounds like there's some pros and cons to each that you kind of went over already. Do you think that some of the nervousness around using power tools is just because they're noisy and scary, or what do you think where the aversion comes from?
I don't know. I think for a while actually it was more costly to do power floats, because that machine is between $5,000 and $10,000.
Wow.
So So a lot of veterinarians were charging more to do the power float. So at the beginning, like when I went to school, there was barely power float. It was, and then there was both. So veterinarians that were used to hand floating kept offering it at a lower cost than the power float. But then eventually it became quite clear that even if there's cons to the power float, it's the pros are winning big time compared to the hand float. And now actually, if it was me, I would charge more to do a hand float because it takes much longer. And you can do a way less good job like with hand floats. It's like with the power float, you can just touch the tooth. It takes, you do one little zip, and then that little point is gone. And if you put a hand float on there, it's gonna take you going back and forth 10 times to get that little point. And by doing that, you're gonna hit the back of their mouth, or if it's the last tooth, well, you can't go past it. So there's some areas you can't really do a good job with a hand float, actually. So I think, and then I'd say, yeah, maybe people are nervous because of the noise. And there's the rare horse that will not tolerate the power float, but it's quite rare that they won't. Usually, I just start it outside of their head first, outside of their mouth, and they hear the noise, and most of them don't care much. So, and actually, I'm sure it feels much better for them to have the power float than to have the hand float going in their mouth back and forth. Yeah, because it's pushing on teeth and compared to a little yeah.
And then the other question that a lot of our listeners had when we posted that you were coming on Facebook was about dentists not doing a lot on the front teeth, but it kind of sounded to me like what you had mentioned as you were just explaining things is that the goal is to do take as little off as possible, right? And that a lot of the things that you're doing elsewhere can affect how the teeth are grinding and lined up, so you don't necessarily always need to take off the front teeth. What's your feeling about that?
So another, like a bit more on anatomy. So the horse's mouth, yeah, it's very long. The front teeth, they touch all the time, right? But while the front teeth touch, while the horse is just resting, the molars, the arcades, and the premolars, they don't touch. So there's a gap back there. So and that's normal. So you don't want the back teeth to touch. So the front teeth touch. When they eat, they will do an 8 motion. So they'll go sideways, like, they're gonna open, go sideways, and then they do a power stroke, and then they come back. So that's how they do this. So while they have to go sideways for the arcades to start touching and engage and grind. Okay, so basically, and then if you noticed, another way of telling a horse's age is when you look at the incisors on the side. The angle is quite steep when they're young, and as they get older, well, they get flatter, right? The angle. So an old horse will have front teeth like that. So basically, the horse's front teeth they're adjusting to them getting older and to the back teeth wearing. Nature is pretty well done, in general. I think we mess with it like a lot, but yeah, the back teeth, the front teeth will wear, the back teeth will wear, and depending on what the horse is eating, they'll wear at a certain speed. So if the horse is eating dry food, actually it's not going to grind as far on the side. Dry food is gonna, because it's not gonna slide well. If they eat like hay with grass with moisture in it, the stroke actually will be longer. So that affects actually how the points will grow. Like if the horse eats our horses eat usually dry hay, so they'll do small strokes like that because it's not smooth. Then there's little points that will start growing here because it won't do this. So basically the front teeth adjust as the back teeth wear down. The front teeth also wear. So what we do with the front teeth is we measure before we float and after we float. How far to the side does the jaw have to go before the back teeth start touching? And this is called the excursion to molar contact. So, and then you're gonna, so I take the jaw, push it to the side, and then when the teeth start separating, it's when the molars start touching. And then you measure that. And there's been like studies that find what is normal in a horse. The average in like a quarter horse is 12 millimeter, plus or minus 3 millimeter point something. It's gonna be quite smaller in a mini. Like mini is more like 5 millimeter, and a big draft horse is gonna be more around 15 millimeter. What they found is that a healthy horse keeps the same year after year, which means that they're wearing at the same speed, the front and the back. So if the horse at 10 years old moves 13 millimeter, when he's 15, you should move 13 millimeter. If at 18 he's moving 15, well, maybe then something is starting to be a problem. And then most horses also, both sides will be equal. So it's gonna be a centimeter this way, start touching, a centimeter this way, this side starts touching. So if it's not equal, often it can be because the incisors start getting crooked, or because there's something at the back. If you got a big tooth on this side that's too long, when you move the jaw this way, that big tooth is gonna hit first. So if you correct that big tooth, then the jaw might just go back to normal, right? So that's why it's always important to look at the back first. And if you've got big steps, so extra long tooth for some reason, you want to correct that first, because after that your jaw may start moving way more smoothly. So then incisors, so that's what you look at basically. If it's moving well from right to left, if it's equal, then and if the molars touch properly on each side, then you don't have to touch them. When you do something to them, it might be because they're getting slant or smiles, or maybe one is broken, like a fractured tooth, and that means it's not the other one that's facing it is growing too much, and then if you let that one grow too much, then it'll start chewing funky. So then you need to correct the one maybe the fractured one needs to be removed, or maybe it's just gonna fix itself, patch the hole. So you want to monitor it. Sometimes you need an X-ray, ideally, to see if it's healing on its own or not, or if it's gonna become an infection. So if you have a missing tooth or a fractured tooth that's not painful, you're gonna have to file the tooth that's in front of it so that it doesn't get too long and start causing chewing problems. So then, so yeah, incisors, you look if they're straight, and if they're crooked, well then, you know, I went to some talks of veterinary dentists talk about it, and there is actually a bit of different opinions also on that. If you have a horse that has really crooked incisors, some will say, well, if you measure and if the back teeth are super nice, they're grinding super nicely, you move your incisors to the side, it's 12 millimeter one side, 12 millimeter the other side, like why would you touch them? Like, he's digesting right, there's no pain, the front teeth, their goal is to grab food, he's grabbing food, food is going in, it's grinding perfect, why mess it up, you know? There's some veterinarians that will say, well, if it's getting worse and worse, and then you notice that, oh, it used to be 12 millimeter and all of a sudden it's 15, well, maybe it's time to start to prevent it from getting bad. So there's kind of a fine line there, you know, of do you really need to do something or not? But basically, if it's not causing problem, don't touch it. That's the general rule.
You kind of segued into one thing that I wanted to touch on. My understanding is you've done quite an extensive amount of training in this area, more than the average veterinarian. So I'm curious, when did you start kind of expanding your knowledge about teeth?
So when we're in school, like, we learn about so much things, and then during our training we have to choose what we're gonna direct our knowledge towards. So yeah, I did a lot of equine because I wanted to go work in equine. Oops. Oh my god. Sorry, guys.
Oh man, that's okay. It'll just make it more interesting to watch on YouTube. So what I did during my schooling is I just think that it's nice to be exposed to a lot of different ways of thinking and ways of working. There's not always just one way that's good, right? Or even simple things like placing a catheter. Someone will do it one way, someone will do it the other way, and then you'll find what works best for you. And I used to struggle with teeth just doing what I wanted with the instrument. Like, sometimes I knew what I wanted to do, but it's hard to get to it with the float. So I felt like I needed more exposure and practice and see how different vets did it so they would get the good results, you know. So then I started visiting and going and learning in a lot of different practices. So I went and it's not just about dentistry, like, it's about medicine in general, but dentistry is a big part of preventive care, so most veterinarians will do it. So I did go learn it in different hospitals in Florida that have like specialists, like surgeons and internal medicine specialists, ophthalmologists, people that do specialty shoeing, veterinarians that do just shoeing, or feet care, and people that do lots of dentistry. So yeah, I visited Florida, a few hospitals there, hospitals in California where they do like MRIs and things like that. Went to Utah, Colorado, Vermont, where else? And then, so then basically I would follow veterinarians and see how they did it, and so learned like that. And then decided to
learn more because there's so much. So I took a course that was taught by people veterinarians that just do dentistry. So that's all they do all day, and you can do so many things that are out of my depth. But at least I know more now. So yeah, and it's super interesting, and it's a super important part of the horse's health, and so I think it's a good skill to have for me.
Mm-hmm. Well, and I feel like we've just scratched the surface. Like you say, it just sounds like there's just so much that we could go into and so much to learn about. I'm curious, just before we wrap up, was there anything else that you wanted to touch on in this episode? Anything that we missed or that you feel is important?
Oh my. What can I do? I have so much more stuff written all over, but
I was just going to say that you came extremely well prepared, and we so appreciate that.
Yeah, no problem.
So people who are listening and not watching here, like the occasional rustle, it's Maude's lovely stack of notes that she's going through to make sure we haven't missed anything.
Yeah. But yeah, no, basically I think I was raised in an area where the vets it's just normal. You do your horse's teeth every year, so you didn't have to tell me. Basically, my trainer said you do your horse's teeth every year, so I was like, okay, I do it. But yeah, sometimes it's challenging to get people to understand that's what you have to do. And once in a while there's barely anything to do, and if there's nothing to do, I'm not gonna do anything, but I'm gonna say that's pretty rare. But last summer, I remember I saw a horse, the lady said, no, he hasn't been done for 5 years. I'm like, oh my god. And then I go in there and there's it's perfect. So I said, well, yeah, let's see you in 2 years. Because the horse was just under 15, eating well, so just did nothing to that horse. But if you do preventive care, you can maintain that healthy mouth for so much longer. When people call and the horse is 21 and never had his teeth done, it can look very bad in there. And then there's not much we can do. We can't. There's things we can't fix. So preventive is the goal, the best thing to do.
Wonderful. I feel like that's a perfect place to kind of close things up. Is there any, promote yourself? We usually tell people that they can promote themselves, but I don't know if you need to do that.
Oh, thank you. Yeah, no, I think looking forward to floating more teeth.
Perfect.
Doing more exams.
Awesome. Okay, well, Mira, is that a wrap?
I think that's a wrap.
Well, guys, here is that little extra tidbit that we promised you at the beginning of the episode. I hope that you enjoy.
So, Maude, I'm just curious if there's anything about incisors specifically that you'd like to add when you're doing those exams and then taking them down.
Yeah. So basically, also, if we touch incisors, there's some rules to follow when we touch them. And like I said, what you do to the front teeth, it will affect a lot what happens in the back, about angle wise, and it's going to affect your TMJ. So when I was talking about that excursion to molar contact, so when you move sideways, the molars engage. So if you remove 1 millimeter of your incisor, it will change your molar, the excursion, by is it 3 3.3 millimeter, something like that. So that's a lot. Just 1 millimeter, it's gonna change this by 3 millimeter, and usually it's gonna shorten it. So let's say a horse has to go, if he has to go like 15 sideways or 17, and that gets really far, and he might get a little sore in his jaw. So if you take 1 millimeter off, then it's gonna go down 3. So if he was at 17, it's gonna be 14, and already that's way better, right? Another millimeter, 14 minus 3, it's gonna be at 11. So that's way easy. So it's pretty rare. You need to, basically you correct 1 millimeter and you check how much difference it made. Then 1 more millimeter and you check again. You never do more than 1 millimeter at the time. And also the rule is you can't do more than 3 millimeter on a tooth, on a front tooth, because you might reach the pulp. If you reach the pulp, there's infection that can go in. It can take years for the infection to make it to the root and start an infection in your bone. So 3 millimeter maximum on the front teeth, 4 millimeters on the back teeth, if they're touching. And then you should never remove more than 3 millimeter when you add what you do on the top one and the bottom one. So it could be 2 on the top, 1 on the bottom, but never more than 3 millimeter, because it's gonna change so much. 3 millimeter is gonna change basically 1 centimeter. So then the horse is gonna really feel it back there, and he's gonna adapt. Like I said, horses' mouths are so resilient. You can do a lot of things, good things, bad things, and the horse he's gonna change, the bone is gonna change, the teeth will adapt, they'll grind different, and he's gonna look fine, but it's gonna sometimes it takes a lot for them to, get fine again, but they can adapt to a lot of what you do. So that's why you need to be careful with incisors also. A little bit does a lot for their jaw. So less is better, basically.
Yeah.
You mentioned when we weren't recording about any sore, like you mentioned that maybe horses shouldn't be sore after a dentist appointment.
Yeah. Basically, it's if the horse is sore, it's because well, maybe you touched the tooth too much. Maybe you heated it up, made some heat damage, or maybe you just changed the geometry too much, and now he's just getting sore. Someone that, yeah. So if you chew different, you use your muscle different, you can be sore. Or if after the dental, it can happen if there's abnormality in the back and we correct a wave mouth or something, and after, if there's like that one tooth that starts touching before all the other, that one tooth's gonna have more pressure, it might be sore, but it's not normal. Like then we would go and look which tooth looks like it's sore, because maybe I didn't make it smooth enough or something. So yeah, if the horse is sore after, it's because either something was done a little wrong, or it's not necessarily the person's fault, but it needs to be fixed, or maybe too much was done, and then the horse, maybe there's nothing you can do to fix that, but wait and it might get better. But yeah, no, a horse should not be sore after a float.
If someone has their horse's teeth done and their horse is sore, is that something that they should contact their vet about? Like, should they tell you that their horse is sore, or is there a certain amount of time or level of soreness that they should see before they bring it up?
Unless I tell them that the horse might be sore, because I pulled a tooth, that's normal. We would give him painkillers. If maybe I had to push on an ulcer to fix the tooth that was hurting the ulcer. So if I expect the horse to be sore, I will tell the owner. If not, yes, I would like my patients to call me back the next day, basically. Or call back the vet that did the work to tell them, because we I like to know if something's wrong. We all like to learn from what we do. Or I would hope so.
If you want more Friends on Horses, you can find us on Facebook at Friends on Horses Podcast.
Check it out for all the latest and greatest horsey news.
You can find us on the web at friendsonhorsespodcast.com.
Or Instagram at friendsonhorses_podcast.
Like what you hear? Help us quit our hay jobs by supporting Friends on Horses. You can support us by rating our episodes on iTunes.
Becoming an ongoing sponsor through Patreon.
Or simply by spreading the word about our show.
Have some feedback?
We'd love to hear from you.
Contact us via email at friendsonhorses@gmail.com.
Thanks for joining us.
Until next time.